Good evening, everyone. Sorry for starting the live a bit late today. There was some internet issue. The internet speed was down, and it's been long time. We could make time for live again, and I'm here to answer all the questions which we might be having pertaining to hair loss, hair transplant, and eugenics per se. So I'll be answering all the questions that pop up live in the chat box, and at the same time, I'm ready to take on some questions which our team has prepared beforehand. So I think this time they have focused just on the topical therapy. So they are saying that what kind of options are available when going in for topical medications for hair loss. So, topical medications is, I would say, the most common and the FDA approved is topical minoxidil lotion, which comes in a 5% strength. So, it comes in a lotion form also and foam preparation also. The foam preparation is supposed to be longer acting, and lotion is also very effective, and the base of lotion can be alcohol most of the times. However, there are some water based minoxidil preparations also available. So yeah, that would be. So now first question has come up from Mr. Chris. After how many days grafts get finally secured, and after how many days one can go out in sun without the hat? So Chris, a very important question. Definitely it's very important for a person to know before actually doing the transplant. So technically, the graft uptake is over by the seventh or eighth day. That means if we have implanted a graft into a new slit, it can be extruded manually, forcefully, if somebody tries that purposely for the initial 7 days. So that's why we recommend the first shampoo on the seventh or the eighth day. And sun protection we recommend for 7 to 8 days post surgery, because the area is healing, and a person who has extremely fair skin can avoid, especially the Caucasians, can avoid sun exposure for 2 weeks. So Gopinath has asked, "Hi ma'am, does topical finasteride or oral minoxidil help for those who don't?" Yeah, of course, Gopinath. Both the things, especially in combination, are working nice, which is topical finasteride gel and oral minoxidil tablets. And definitely, in people having side effects with oral finasteride, they can switch to this regime, and they can take topical minoxidil also. So they can take topical minoxidil, topical finasteride, and oral minoxidil. So that would be my suggestion. Uh, then Mr. Binith has asked that I'm 23 and my temples are receding and there's some thinning in middle part of the head. Yes, Binith. So this is a very common situation when you have mild recession at a young age. So definitely you should not opt for a hair transplant. You should opt for medications and a holistic approach to stop the ongoing hair loss. Don't rush for a transplant at this young age with such an early stage of baldness. Even if your age was, let us suppose, 35 plus or 40, and if you have an early stage of baldness, again my approach is conservative rather than going for the surgery. Then Sonic has asked, what are your latest views on oral minoxidil and oral dutasteride? Thank you, Sonic. So both of these drugs are not FDA approved, first of all, and both of these drugs are highly effective. That's for sure. Oral minoxidil, the safety profile is very high, and the only problem is that it can lower the BP in some patients. So a person should be ready to do BP monitoring and ECG monitoring at 3 monthly, once in 3 months interval with oral minoxidil, and they should start with the low dose and gradually hike it up under the supervision of their treating dermatologist. And oral dutasteride also is very safe, and it can be taken every day once your physician has, dermatologist has prescribed it. So that's my view on oral dutasteride. Okay, Binith has asked the medication. So Binith, this is a live, it's a social media live, YouTube live. So I can't be suggesting the medication straightforward. But I, as a doctor, as it's an educational session, I can tell you that the FDA approved medications are oral minoxidil and oral finasteride and topical minoxidil. These are the two FDA approved medications. You should get those medicines and start until only and only when you have your prescription by the doctor. So that would be my take on that. Mr. Eric Cohen has asked, where do you do HT from beard? When you do HT from beard. So Cohen, we take beard as beard grafts for beard to scalp transplants in patients with extreme grades of baldness, which is grade 6, grade 5, grade 6 baldness. When the area to be covered is huge, okay, and then we have to do a lot of area which the graft requirement is huge, like 4 or 6,000 grafts, and scalp can yield only 2,500 to 3,000. In those scenarios, we take beard grafts and add on to the scalp graft to increase the surface area of coverage. The other scenario where we are using beard graft is beard to donor transplant, which is called donor farming. That way we can prevent donor thinning. There is one more scenario where we can do beard extraction. Is some people with white hair, they want to reduce the beard density and laser hair removal is not working. So there also we are doing extraction of the white beard hair to reduce the density of the beard if somebody wants to get rid of their beard. So that is something which can be tried. Mr. Shrikar has asked, can I go for 2 to 3 small sessions of hair transplant? Yes, of course, Shrikar. You can, don't need to go for a mega session or a full-fledged session for the whole bald area. You can go step by step. So you can go for a very focused, localized approach, restoring a one particular area, and then go for a session, second session, third session later on. But my personal suggestion is, when you do one session, you should assume that it should look natural even if you don't go for second or third session. So that is how you should be planning it. So Eric has asked again, has asked, what can be done for less seeing? Sorry, Eric, I didn't get the meaning of your question, so I like you to elaborate on that. Then somebody has asked, I'm an athlete, how soon can I go back to the training? So it's a very important question. So if you are a heavyweight lifter, you can go for heavy exercises 1 week after the first head wash. For the hair, for all the heavy workouts, you can go for heavy workouts after 1 week of the procedure. If you have done a FU or a DHT procedure. However, if you have done a strip technique, the FUT technique, then you will need to wait longer based upon your doctor's advice. Uh, Medicines, again, Beneath has asked the same questions. So, Beneath, as I said, the US FDA has approved oral finasteride and topical minoxidil lotion for treatment of thinning hair. Yes.
Ma'am, we already have a question which says how many hours will it take for 2000 grafts to be implanted?
So for 2000 grafts, it would take 1 day, probably I would say 7 to 9 hours. Maybe we start at 9 o'clock in the morning, we'll be finishing by 5 or 6 p.m. in the evening.
If we eat finasteride, are there causes of anxiety? Because I am facing anxiety.
So yes, so yeah, somebody has asked if finasteride can lead to anxiety or not. So you must understand, anxiety is a very subjective side effect. Okay, some people have complained of mental fog, some people have complained of low mood, and yes, anxiety can happen theoretically due to finasteride. And if you're facing those side effects, better to stop the medications. Can you please, Ankita, summarize the questions of Mr. Cohen, Eric
Yes,
Cohen?
doing that.
He has sent 3 messages so that I can answer those.
Yes.
In the meantime, Harris has asked, do we give any sedation? So we don't give an IV sedation. We give a low dose sedative one on the day of procedure, especially if the patient is very anxious. However, if patient is not anxious at all, if the session size is not huge, like we're not doing 5 6,000 grafts, BP is normal, everything is normal, we can avoid sedation also. Sedation is not mandatory at Eugenix, and we don't give IV sedation at all. So Lokesh has asked, does high humidity cause hair loss? Lokesh, so if high humidity leads to oily scalp and oily hair, okay, and you're not able to cleanse your scalp properly, then yes, it can lead to seborrheic dermatitis, and then it can lead to hair loss. But per se, humidity per se will not lead to hair loss. So Mr. Feridun has said, I talked to consultation members. They said after we showed your case, you rejected to accept my case. Uh, my case will not get neutral result. Sorry, Feridun, I would suggest, can you just resend a message and you can quote this live session in your message, and I will re-look at your pictures, because we receive a lot of pictures every day. If you don't require a surgery, if the thinning is in early stage, or if your donor is extremely exhausted or depleted, then yes, we might say that you are not eligible for transplant. And the reason we are telling that is for your own benefits, not that we don't want to do your case. So it's not that we are rejecting your case, it's that we are telling you that you may not be the right candidate for the procedure, so it's for your benefit only. So Mr. Jay Nayak has said that he has already done 2 transplants with Eugenix. Is there any other option of finasteride for medications? Again, as I said, you can opt for a low dose finasteride or topical finasteride, or a combination of topical finasteride and oral minoxidil after you get prescription from us. So you have to consult us one again, and then we can prescribe those medicines. Okay, Eric has said that if you take graft from beard, it sometimes white and seen on and head as well. What can be done? Okay, so Eric, the white hair will grow as white hair only. Okay, so gray hair transplant, you must have seen the results which are growing are also, the hair are also gray. So you can just put hair color. Okay, there's nothing we can prevent that color change. Okay, so the white hair will grow as white only, we can't make it black. Okay, sorry for the delay. Binith has saying that you're opening center in Nepal. And Niranjan, how to safeguard existing hair without finasteride? Very important question, Niranjan. We are also wanting to have a permanent solution. So as I said, if you are having side effects from finasteride, it's not end of the road. Okay, you can try very low dose oral finasteride, you can try topical finasteride, oral minoxidil, combination of topical oral minoxidil along with topical finasteride. All those things you may try. uh, I will avoid questions which are being repeated, so that we can cover all the important topics, all the burning topics which you might be wanting to ask. I'm thinning in my crown and balding in my hairline. Again, Adarsh, the answer is the same. Going for the medications would be the best choice. Uh, Shikar has asked, we have already answered those questions. Yeah, my hair transplant journey. This person has asked, is it necessary to take both? No, it's not necessary to take both. Out of these two, the oral finasteride is more important, and I would say something important which if we have to rely on one thing, then I would rely on oral finasteride and not on topical minoxidil. Okay, Mr. Alim has asked about greasy sticky dandruff. It's a very important thing. All of us in these humid conditions face dandruff, okay, and it leads to greasy sticky scales. All those greasy sticky scales, they can get infected, and we can develop folliculitis on the scalp, we can develop pus filled lesions on the scalp. Okay, so these are the problems, and it can aggravate the hair loss also. So the most important step is stop applying exogenous hair oil. Okay, so don't apply hair oil the way we do in India. We start applying hair oil every day to our kids also, and adults also keep on doing that. So first step is stop doing that hair oil, exogenous hair oil application. We have a lot of endogenous oil production in our hair roots. Okay, so that hair oil production which is happening in the hair roots, as there is a sebaceous gland adjacent to our hair root, that's why it is called a pilosebaceous unit. Pilo means hair and sebaceous means oil producing gland. So in our scalp we have pilosebaceous units which keep on producing oil day in and day out. That oil gets collected on the scalp skin. So second step is applying that oil, applying the shampoo properly so that oil gets rinsed off completely from our scalp skin. So this is, I would say, the second most important step to prevent dandruff. So stopping the hair oil and doing a proper regular shampoo will get rid of all the dandruff. Now people face the problem of hair thinning and baldness. They get scared to shampoo their hair properly, and they feel that if they shampoo more they will lose more hair and then the baldness will accelerate. Due to that fear, they don't shampoo their head properly and they don't cleanse their scalp skin all over the place. So wherever the cleansing is not done properly, that oil layer keeps on accumulating and it leads to the growth of a fungus called Malassezia furfur. That fungus leads to scaling, and that scaling is called dandruff. Okay, so that's how the pathogenesis evolves. So if somebody stops hair oil and does a regular shampoo, they will not develop dandruff at all. What's the ideal frequency of shampoo? I would say 4 to 7 times a week. Okay, depending upon the weather conditions, depending upon the hair length, and how much your endogenous oil production in the skin is happening. So 4 to 7 times in a week, one should be shampooing their scalp. So if somebody is doing these three things religiously, they won't develop dandruff. However, if they still develop it, then their dermatologist can prescribe ketoconazole, 2% ketoconazole shampoos. They are available for once a week preparation. There are other topical preparations. And if dandruff is extremely severe, they will give you some oral medications also, which consists of oral antifungals also. So Mr. MD has asked, can we go for a repair after 8 to 9 months of hair transplant? So, yeah, I will not suggest that. Mr. MD has asked this because at 8 to 9 months, you don't achieve full results of surgery. You should wait for 12 months post the date of procedure to see the full results. Okay. And if you feel the density is less, yes, we can work on topping up the density. So all those decision making, and we should start judging the results whether they are right or like whether they are optimum or not once we have achieved the 12 months mark from the date of procedure. So Adarsh had asked ऊपर में that hair fall has rate has increased hair fall in the hairline due to tightening of the cap. So if you wear a cap too tightly, it won't cause hair loss unless the way cap is being worn, it is causing pulling of the hair roots. Then yes, it can cause baldness, the cap. But otherwise, cap doesn't lead to baldness person. Yes, please be fast. Yeah.
I'm using minoxidil for more than 2 years now and still haven't seen any progress in my hair growth. But it is surely slowing baldness.
So
Should I start Finasteride? I'm only 19.
yes, sir. So basically, minoxidil and finasteride both, they will retard the process of baldness. They may not halt it completely. So you may take it like this, that if you were not taking that topical minoxidil, then maybe your baldness would have progressed much faster, or you would have landed in a higher grade of baldness. And yes, if you are using just one drug, adding the second drug will definitely give you a lot of benefit.
Alim
uh,
has asked, do you have patients using daily 1 mg Finasteride without having any side effects?
Yes, Alim, we have patients who are using it for more than 15 years, 20 years without having any side effects. Just a sec. I think we missed a lot of questions before this particular one. Combing can cause MBP fast? No, combing doesn't lead to hair fall. Abhishek has asked, should he switch to finasteride? Yes, Abhishek, finasteride can definitely be considered, but first seek your doctor's consultation once, get a prescription, then yes, adding dutasteride will increase your results. Mr. April is asking, he's getting half of 1 mg. Yes, that's all right because half dose also plays a good amount of role. But if you're facing side effects from 1 mg, then only you should switch to the half dose. Otherwise, try to take the full 1 mg dose. That would be best for you. Mr. Sai Deepak had asked, any other medicine, natural one, which has, so saw palmetto is a natural extract which has same side effects as finasteride. I think we covered those questions. Mr. Lee has asked, is SMP a bad idea on recipient area? No, it's not. SMP is a good idea. It can be done in thinning areas. And yes, we'll be providing SMP in future. We will be providing, doing research on the best ink and equipment, and in terms of the SMP results not changing their morphology. My biggest fear with SMP is the dot becoming confluent with other dots so that it doesn't look like a diffuse discoloration. That is unnatural according to me. The other thing is the dot changing the color. So these are my two main concerns, due to which we are not offering SMP right now. But yes, we are doing our research in terms of instrumentation and ink, and if we actually feel that we can give extremely good cosmetic SMP results, we'll be definitely be introducing it. So yeah, that is our take on SMP at Eugenics. Mr. Clint has asked, is perfect HD possible for straight hair? Yes, of course, Clint. It can be done for straight hair also. And the curly hair definitely will grow as curly hair after the transplant, and it blends well, it looks good, and it provides a good volume. So the advantage of curly hair is, because the hair caliber is more, you get a good voluminous result, you get a very good coverage. Whereas with fine straight hair, you may not get that good coverage. But having said that, even patients with fine straight hair, after the transplant, after attaining one particular length, the hair start becoming wavy or curly. So this is a normal phenomenon. And why is it happening? Because uh, curliness, some people have naturally curly hair, but curliness can also occur due to thinning. So when we do a transplant, we are not planting the hair very very closely. Okay, so it's a simple phenomena of physics. Okay, that if all the hair are extremely close by, and when they are growing, they provide a physical support to each other and they remain straight. Okay, so if hair are dense and sitting close by, they will remain straight. However, in patients with straight hair after the transplant, what happens is the transplanted hair are not so close by. There is a significant amount of gap between two hair, due to which they don't provide that much physical support to each other. So after attaining one particular length, they become wavy. Okay, so that's what I have seen in patients with fine straight hair also. After doing a transplant, their hair tend to become curly, and it's not damage to root or something. It's because of the simple physics that the distance between the transplanted hair is more than natural hair. So this is a thing that we have discovered and not told educated people a lot about. But yes, the transplanted hair are curly, the transplanted hair are frizzy, and it's a normal phenomena. You have to put active efforts in terms of styling the transplanted hair. So you can start using hair gel or hair wax to style your transplanted hair. Okay, especially if you have a used body hair also, so there the requirement of these things become all the more mandatory. Right, Mr. Devi is looking forward to do the procedure with Dr. Samesh on 6th. So most welcome, Devi. Will be happy to host you and happy to give you the best results. Mr. Niranjan has one doubt. Okay, he's saying he's 25 years and he's planning to shave his head. And can he do a transplant at the age of 27? Yes, why not? You can do a transplant at the age of 27. That's not a problem. And at grade 4 baldness, yes, transplant is a good idea. I would say the ideal stage. You can think of transplant at this stage. And but one thing, Niranjan, you must keep in mind, when you are going to the doctor for assessment whether you are a good candidate for transplant or not, which areas should be operated, which areas should not be operated, you should not go with a shaved head. Okay, you should grow your hair at least 1.5 2 months long, or minimum 1 month at least, so that a doctor can make a good assessment. that this is the area which is fully bald, this is the area which is partially bald, and this is how the donor situation is. And doctor will be able to make a accurate donor assessment with long hair only. Okay, so it's very important for you to grow your hair long, and so that we can look at the degree of reverse thinning also. Yes, tell it fast. Yeah.
I'm suffering from grade 4 baldness and unable to have a hair transplant. Now, kindly suggest me what to do to retain my existing hair.
So I think this is a repetition of the same question. If somebody has been denied a transplant for whatever reason, you can reconsult us once again, that what is the exact reason why the doctor has denied for the transplant. And for retaining the hair, we have already covered this. So we should avoid taking the same question again.
The donor area which is enriched by using finasteride before a hair transplant procedure. So those transplanted hair are not at risk after stopping the finasteride.
No, they are at risk after stopping the finasteride. After you stop finasteride, all the hair are at risk of uh, thinning, because there is no safe donor zone. In reality, the so called safe donor zone also undergoes some miniaturization, as we have seen after decades of experience.
Ma'am, Bernard has a question. If a patient is using topical finasteride or minoxidil solution, how long after the HT procedure can the patient resume using the solution?
I think I lost the track. Can you bring me on the from where to start? So after the procedure, we can start topical minoxidil in the non-transplanted zone, maybe 1 week or 10 days after the procedure. In the transplanted zone, my personal recommendation is to start it after 2 months of the procedure. Okay, the reason being, according to my experience, and I'm totally taking a liability on me that it's my personal decision, because I have seen some patients of hair transplant who start applying minoxidil in the operated zone developing allergies reactions. Okay, so that's why my recommendation is to stop at least 2 months post surgery before you restart minoxidil. But on non-transplanted zone, so let us suppose we have done a transplant in the front, for the back area, mid scalp area, we can still apply minoxidil without an issue, and it can be started as early as 7 to 10 days post procedure. So Mr. Lee has asked how many grafts are required for grade 6 baldness. So Lee, there are a lot of factors which get into play. So this is very important thing which everyone should know. With grade of baldness, we cannot give one figure of the graft requirement, and if somebody is doing that's a wrong approach. Let me tell you why. Every human body is different. Okay, so the scalp size or the head size varies from person to person. Some people have an extremely small head size, some people have medium, some people have a large head size. If somebody's height is more, definitely their head size will also be proportionately large. Then comes the skull shape. Okay, so this is a very important thing. There is something called cephalic index. Cephalic index is, so our skull has an anteroposterior diameter from the forehead till the back of the head, and there is a transverse diameter. Okay, so there is a shape of skull which is called dolichocephalic. Dolichocephalic scalp is the one which is not too broad. The transverse diameter is less, but the anteroposterior diameter is more. So in the dolichocephalic scalp with grade 6 baldness, the graft requirement may be less. Why? Because this area of baldness is very narrow in the transverse diameter. Okay. Then comes the brachycephalic scalp, which is just the opposite, where the transverse diameter is more and the anteroposterior diameter is less. In that same patient of grade 6 baldness, because the surface area becomes more, your graft requirement becomes more. Okay. Then there is a mesocephalic scalp, which is between dolichocephalic and brachycephalic. So in between. So as I said, head size and skull shape. These are very, very two important factors which will determine the number of grafts required in a patient of grade 6, grade 7 baldness, for that matter, even in grade 1, grade 2, because these factors play a very important role. Because we have to, when we are, even if we are doing just the frontal, we have to cover from one end to the other. So the transverse diameter will play a role even in case of grade 2, grade 3 baldness, where we are doing the frontal hairline reconstruction or the frontal region reconstruction. So we should not go for one standard figure when it comes to the number of grafts required in the grade of baldness. Some people have generated automated systems that you just put your grade and you will immediately get the graft. So there is nothing called an automated graft calculator. So and for a doctor also, like even if you share your pictures with me, ideally in ideal scenario I should be telling you a range of grafts required, because I don't know when until I meet you personally, that what's the head size. Okay, I can make a fairly good assessment. I would say my accuracy will be close to 70 to 80% if I do a pictorial evaluation. So that's why a good doctor who is doing a pictorial evaluation, a virtual evaluation, should give you a range of grafts. Okay, and generally we try to underplay the number of grafts required. Okay, we try to draw a very, very conservative hairline in grade 6, grade 7 baldness. So yeah, that would be my take on that. These days with AI evolution, like people are getting into AI, they want everything automated. Just you just put the grade, you should get the grafts. So there's no general formula like that, and there should not be a general formula for the same. Mr. Madhva has asked a very important question. Is screen time causing hair loss? Very interesting. When I use phone, company, computer or TV like 3 hours, my hair fall increases that day. So yeah, it's a very interesting question. So I don't think screen time leads to hair loss, but yes, it leads to loss of a lot of other things. Your valuable time which is the most valuable thing, you tend to lose that, but not hair loss per se. Yeah, Mr. Varun has said that he went for 6 PRP sessions, but the hair fall didn't stop. So that's a very common finding, Varun. Hair PRP doesn't work for everyone. So I have seen a big percentage of people not responding to PRP at all. So it's not a very, very dependable sort of or assured sort of treatment. Mr. Alim has asked, please put a detailed video on Finasteride. More question are about only Finasteride. Okay. Okay. So which aspect of Finasteride you want us to cover? We have already created a video about the sexual side effects of Finasteride. We have also created a video about the mode of action and everything. But if you tell me one specific question or specific topic related to Finasteride, we will definitely love to make a new video upon that. Kiran has asked very important question. Many people ask me this, ma'am, can oily skin be treated with medicine? No. So Kiran, the oily skin cannot be treated with medicine. In fact, oily skin is a sign of healthy skin. The only thing that the people with oily skin should take care about is the kind of skincare products they use. So they should not be using cleansers which are mild. So they should be using some optimum cleansers which can rinse off all the extra oil that is produced in the facial skin and the scalp skin. And there is no drug which reduces the oily skin. Yes, there are some drugs which we give to patients of acne that make your skin dry, but the purpose of giving those drug is to cure the acne, the pimples and the big nodules that they have on the face, and it tends to produce dryness on the face as a side effect. But as such, you should not be taking any drug to cure the oiliness. Oiliness is a part of normal healthy skin. The only thing, your cleansing process should be a bit more elaborate, more frequent. And you can consult your dermatologist for the best face wash or the shampoo according to your skin type. This I've already covered, no? So I'll click on questions which we haven't covered. I have a little bit thinning on the crown. Minoxidil help me 50%. Should I go for topical finasteride? Yes, you can go for a topical finasteride, Sumit. That will help you. But again, as I said, take a prescription and then start it. Screen time I've covered. Go down. Eric has asked, what could be done if Propecia becomes less effective? So yes, Eric, this has happened over years, especially in the hairline and the frontotemporal area. Some people have experienced ineffective of finasteride. That's okay. That's nothing to worry. And to be very honest, you can't do much about it other than you can add topical finasteride also, and just increase your nutrition and multivitamin supplementation. Nothing more than that you can do. Oral minoxidil is a new player now in the game, so you can check your blood pressure and ECG and get a prescription of oral minoxidil from your doctor. Adarsh has asked again the question of cap. I think Adarsh is very much fond of using caps. So it doesn't lead to alopecia areata, Adarsh. So Adarsh, cap doesn't lead to baldness. Cap doesn't lead to alopecia areata. But yes, if cap is made of cloth and you are not cleaning it, it has become dirty, oily, then yes, it can aggravate dandruff. Bikram has asked very interesting question. I think we should make a video on this. How do I know that my hair loss is due to vitamin D deficiency or B deficiency or DHT? So Bikram, this is a very important thing. Male pattern baldness or the androgenetic alopecia. It typically affects the front, mid, and crown of the scalp. And if you have baldness in these three zones, whereas your sides and the back side, which is the donor area, is very dense and voluminous, then you must understand that it's a male pattern baldness. It's not due to some dietary deficiency. If you have hair loss due to dietary deficiency, that's a global hair loss. It affects all the areas of the scalp, so there will be a diffuse thinning all over the place. So this is a very simple way to differentiate the cause of baldness. But yes, in a patient of androgenetic alopecia, if they have simultaneous vitamin D deficiency or any other mineral deficiency, then that can aggravate the baldness. So definitely they should rectify the nutrition, but they should know that the cause of baldness is male pattern baldness and not dietary deficiency. So Rohit has asked about hair cloning and cure of baldness. So Rohit, the research is on. You must understand we as doctors are more of clinicians or surgeons. We are not that much into research. The actual research is done in labs, okay? So we have dedicated researchers for that. So what is happening in scientific global communities is that we have meetings, yearly meetings between the researchers, the top notch researchers across the globe from various countries. They present their research, and we as doctors, we collaborate and look at their research and see how the clinical trials are coming up. So as of now, hair cloning and stem cell research and everything is in the phase of research only, and we as doctors and surgeons can promote something only and only if we are confident of the approval process, of the results, and if we are confident enough of the safety of the treatment. So let us suppose tomorrow cloning becomes successful. So it's not that we'll start offering cloning straightforward. We look at the studies, we look at the evidence, we look at the technology which they are using, and we'll do it on ourselves, on our staff. Basically, we'll, before actually offering to a patient, doctors do ample amount of research actually before giving it to patients. So this is something you must understand. Should not go with fashionable terms of stem cell, anti-aging treatments, and cloning, hair multiplication. So all those things, unless they are extremely safe and effective at the same time. If something is safe but not effective, there's no point offering it to you. So Adarsh has asked the same question again, that he has small bald patches. So Adarsh, maybe you have androgenetic alopecia areata. You should seek your dermatologist consultation and then think of it, think of treating it and not blame it on the cap. Mr. Planeteers, okay, has he did a transplant. He's Vamsi from Pune. He did a transplant at Bombay and he's happy. Thank you, Vamsi, and thank you for reconnecting with us. Yeah, I think he's putting the message again.
Ma'am, hair
Oh,
loss due to vitamin D and vitamin B. Is this type of a hair loss reversible?
yes, that I already covered. Vitamin D, B deficiency that leads to global hair loss. So first of all, you have to prove that it's due to those deficiencies by doing the blood test. Then you have to supplement, and then yes, if it's due to dietary deficiency, it will definitely get reversed.
Can
Mr. Akhtar has asked, when we do a hairline correction and extract the hair, when you dissect the plugs and replant it, yeah. Okay, okay. So Mr. Noshin is asking if somebody has plug grafting, okay, or doubles or triples in the hairline. If we extract them, dissect them, and implant them, will they grow? Yes, Noshin, they will grow. And if their roots and the bulge area is not damaged during this whole process, it's definitely going to grow.
can hair direction, hair curl be rectified with correct hair transplant?
So as I covered already, the curliness is happening after a hair transplant in most patients, whether they have curly hair or fine straight hair since beginning. So this is a normal phenomena which is seen after a hair transplant. So there's nothing which can be cured by redoing it. Okay. If you do a fresh new transplant, again you can get curly hair.
What is the safest medical treatment for female diffused loss? Is it safe to perform a transplant in that case? Lee has asked
Lee, yeah.
this.
So Lee, we have classified female pattern baldness into three grades. Would be grade one, two, and three. In grade three, yes, it's a severe stage of baldness where the gap between pre-existing hair is too much. There, it is safe to do a transplant. But in grade one and grade two, we avoid doing that. Yeah. So Krishna has asked this question. Uh, that telogen effluvium affects the top of head. So telogen effluvium, Krishna, also comes under global hair loss. So it affects the whole scalp. It's not just the top of the scalp. Mr. Shadul has asked the dose of oral minoxidil. So Shadul, this is, as I said, it's a live session. I can't be prescribing, but the usual dose which other doctors are starting is with 2.5 milligram, depending upon your overall baldness situation and also your age and your baseline BP. Some people start half of this dose, which is 1.25 mg, and then it is gradually scaled up based upon your response to 5 mg and 7.5 mg every day also. One thing is about oral minoxidil, is about the diffuse hypertrichosis. So if somebody is taking oral minoxidil, they can develop excessive body hair growth, okay, which is not a problem in men, but in women it can be a big problem. So it's not a drug of choice for female pattern hair loss.
Hair curling is something I experienced. My original hair was straight. Do we know why the transplanted hair takes on these characteristics?
Yeah, I just described the whole physics behind it. So
Did HT in 2019 was facing thinning? What do I do to improve the density? My donor is weak. I cannot take another session of HT.
So viral,
Viral
he's
lock.
yeah, he's facing thinning. So you have to consult your doctor again. You can start multivitamins, oral minoxidil, oral finasteride. You can do PRP sessions to improve your density. Basically, we have to see, assess, and then decide the best plan of action. I think, is it, how much time is it? 45. So we've already completed 45 minutes. I think we have some very, very important questions which are left. And can we get the record of these questions and then we can post those replies, because we've already touched the 45 minutes mark. And we did find some interesting unexplored questions this time. And I loved answering them, and probably we'll make more detailed videos on them. So thank you everyone for the session.